Well, good morning, good morning, good morning. How are you? I'm hoping I've finally got my lavalier mic sorted out. Not on back to front. Just dropping some kids off at school. So, finally went for my diabetes nurse visit. Unfortunately, I have to report it didn't go brilliantly. She had a cold. Problem is, I was always anticipating this, is that when you've got someone who's like does the same thing day in, day out, there's not going to be very much individuality attached to the consultation. There's going to be very much, hello, I'm the diabetic nurse, and this is what we need you to do. And the consultation was very much based around what they needed me to do and not at all what I needed them to do. So, as I say, it didn't go well. I mean, it went off badly because she was running 20 minutes late. And she had a shocking cold. She was wearing a mask. She suggested that I wear one as well. When I said, no, I'm not that bothered. She was like, well, don't you wear one at work? And I was like, yeah, I do when I'm treating people, but not when I'm talking to people, So I suppose there was a sort of a clash of personalities there, which was a shame because I didn't, but I don't know. This is just note to self, right? If you're running 20 minutes late, and then those sort of consultations where one person's saying something and another person's saying something, and both of them are talking at cross purposes. They're not disagreeing with each other, but they just both want the other person to listen to them, and they're not prepared at all to listen or respond to what the other person's saying. So you end up with two separate conversations, one-sided conversations going on simultaneously, and neither side caring at all enough to engage with the other side. So it ended up being a bit like that. I had a doctor who said my liver enzymes were up the spout, and I said, yeah, well, I've been diagnosed with Gilbert syndrome. And he said, what, Gilbert syndrome? And I said, well, yeah, all right. But I said, well, he was French, so I just call it Gilbert. So, and then from then on, he insisted on emphasising the fact that he's calling it Gilbert, just as if to say, I'm in charge here, not you, and I shall say what it's called, not you, And so you get this situation where people who are to a certain extent arguing from a position of weakness because they don't really know. I'm not going to say they don't know what they're talking about, but what I'm saying is that they've sort of scrabbled together some advice to make it look like there's a body of knowledge on something, which in 5 years' time we might find out is completely wrong, and diabetes is caused by eating blue Smarties or something, but because they want to appear authoritative and knowledgeable and professorial and learned, and it's always a mistake to do that. You're far better off saying, we really don't know what causes diabetes, but it's being overweight is a contributory factor. And I've lost, you can probably tell from my face, I've lost 10 kilos over the last 3 months or so. But of course she doesn't know that, and she didn't ask me that. They just ask you to jump on the scales and then tell you that you're overweight. So there was other issues as well. I mean, they put me on 500 milligrams of diabetes meds tablet, 500, one tablet. She said, what are you taking? One tablet? I said, yeah, 500 milligrams. She said, yeah, one tablet. Like, I don't know that there's only one tablet. I don't know if the tablets come, as far as I'm concerned, one tablet is not how you measure drugs. Do you know what I mean? It's like, you don't say, oh, I'm taking one antibiotic a day. It matters very much what the strength of that tablet is and which tablet it is. But she's used to dealing with lay people. So of course she's like, oh, you're on one tablet. So again, we have this sort of, I'm the authority on this. If I want to describe your treatment in terms of number of tablets, I will. So I'm like, okay, whatever. Oh. But her objective really is to try and try and deal so far as possible with the causes, or the potential causes, or the potential exacerbating factors, things that are going to make it worse, things that are going to cause me to lose my eyesight or my toes or my kidneys, and and even then really only on a forced basis, because this really only didn't come to a head until, I'll tell you what, I'll turn the blowers on and see if that makes much difference to the noise. I'll turn the blowers on, I'll put noise cancellation on. That's the noise cancellation on. So it became apparent that diabetes was a bit of an epidemic, about 10 years ago, 15 years ago, and then it was costing the NHS a fortune, because a lot of people who've got diabetes are on free prescriptions, and by definition now, if you've got diabetes, you do get a free prescription. And so they said, look, surely it'll be cheaper for us to treat this earlier and have less money spent on amputations and and having to look after blind people later. So almost in a forced way, it was the first bit of prevention that I really heard of in the NHS. And it wasn't because they were like, it was a sensible move. It was because they were just being really, really hurt by the cost. And so now they sort of like to think that they put in a lot of work into prevention, but they're not. This is not prevention insofar as it prevents anything. You have to wait till you get the disease, and then they do a bit of prevention. You know what I mean? So prevention. If you go into a surgery, and I've been into many NHS dental surgeries, and you look at the waiting room and you can see that one or all of the receptionists have got some sort of fetish for posters, and you've got posters all over the place, and you've even got commercial posters like Colgate posters and stuff like that, and Smile Line, Invisalign posters as well. In the hope that if you decorate the whole place with posters, the posters are by sort of osmosis are going to, well, you put in the doctor's surgery, there's posters up with symptoms of pancreatic cancer, symptoms of what to do if you have a stroke, etc., etc. It's all good health information. I mean, you can't fault any of it, but it's very much a sort of a blunderbuss approach. which is how I've always seen things like asking dentists to do anti-smoking, smoking cessation advice at the checkup, because patients see their dentist possibly more than their doctor in the early years, when they're 20s, 30s, 40s. Although I would probably dispute that. I mean, that's the point at which there's hardly anybody goes to the dentist. And so they said to the dentist, look, while you're doing a checkup, and 6-point gum check and CPITN and a tooth wear analysis, and also, would you mind possibly spending 5 minutes trying to convince the patient who doesn't want to give up smoking to give up smoking? I don't know if you've ever tried to convince someone who doesn't want to give up smoking to give up smoking. It can't be done. Can't be done. Spent years trying to do it, never worked. But this blunderbuss approach is a favourite of the NHS. And I think it's a bit demeaning, because it's sort of centred on the premise that the public as a whole are pretty stupid. And just if someone could only explain to them what they should be doing and what the facts of life are, they'd all be happy and bright. So basically so when you walk into a surgery that's got loads of posters, you're already, your ship is already halfway sunk. So get that here without banging into anything. So, and of course she's got this fantastic folder full of leaflets about diabetes. Every diabetes leaflet you can think of is in this folder. And they all say the same thing. Basically, I can summarise it all for you. Basically, it says, don't blame yourself for getting diabetes. It's a bit of a shock. Don't blame yourself. But by the way, it's almost certainly because you're a fat bastard. Come on then. So what you should do is you should eat less and move around more. And you read the next leaflet and it says eat less and move around more. And then you've got a massive great cookbook, right? 20, 30 page cookbook. For how to eat for diabetes. And then you've got, and the other thing was, through a charity, a diabetes charity, which I don't know, maybe government, for maybe a quango, I don't know, you get a 4-hour induction into being diabetic, which, and she's like, oh well, I can send you on this 4-hour course about how to cope with being diabetic. And she took one look at my face and said, you don't fancy that? And I'm like, no. And I found out later that it's because, it is like a group therapy thing, which I don't like anyway. If I'm going to lose weight, I'd rather figure out how to do it rather than go to something like Slimming World or where you just meeting together with a bunch of people. I've never been very social. I know it probably come as a great surprise to many of you, but I'm not a people's person. So I don't want to go to a 4-hour speed awareness course on diabetes, whether it's free or not. Bearing in mind that all they're going to say is, make sure you're on the right dose of metformin. Oh, and one final thing, she said, I think we'll bump your metformin up. So I'm like, why? We're waiting 3 months to give another HB test to see whether we need to bump my metformin up. She said, well, why don't we just bump it up a bit anyway? I'm like, So that's when I found out what the nature of her clinical expertise is, basically putting you on everything. She wants to institutionalise me. She wants to medicalise me. She wants me to get me in the system. And so, in addition to suggesting that I double my metformin dose on the basis of nothing whatsoever, apropos of nothing whatsoever, she also says that my statins are a bit high. Shouldn't have done that, shouldn't I? Not my statins. My lipids are a bit high, so she wants to put me on a statin. And then she said my blood pressure's a bit high, so she wants to put me on a blood pressure tablet. And I'm like, actually, no, that's not what I've come here for some help with my diabetes, not to end up with a list of drugs so long that it's going to take 2 pages on the prescription form to get them all repeat prescribed. She wants to regularise me. She wants to set everything totally, all my parameters within perfect, which and one of my parameters is how many tablets I take a day, and that's not one that she's considering at all. That's not a parameter that's on her list of parameters, is it? So anyway, I don't know. Perhaps she'd be better off working in a car tuning centre or something. But I mean, you can't when you're. I've got to go. All right, I'll talk to you later. I might touch on it later, but basically, when you're running 20 minutes late and you're lecturing someone, it's not the best time to take their blood pressure, is it? All right, I'll talk to you later. Bye.